In Section 4, we will learn about hand washing, what is an exposure, if you're exposed, things to remember. Washing your hands is the most effective way of reducing exposure to most diseases. Any surface can have contaminants on it, so regular hand washing is essential for breaking the cycle of passing on infectious germs. The use of gloves is important, but should never replace hand washing. If you don't have access to running water or liquid soap, use a pre-moistened towelette or antibacterial lotion or gel until you can get to a faucet and soap. However, please remember, you still need to wash your hands. In regards to hand washing, always use warm running water and liquid soap. Antibacterial soap may be used, but not required. Wet the hands and apply a small amount of liquid soap to the hands. Rub hands together vigorously until soapy lather appears, and continue for at least 20 seconds. Or you can hum yourself Happy Birthday or Twinkle Twinkle Little Star. Rinse hands under warm running water. Leave the water running while drying the hands. Dry hands with a clean, disposable towel. Turn the faucet off using a disposable towel. Discard the used towel in a trash can lined with a fluid-resistant plastic bag. Consider using hand lotion to prevent chapping of your hands. When assisting a child in hand washing, either hold the child, if an infant, or have the child stand on a safety step at a height at which the child's hands can hang freely under the running water. Assist the child in performing all the above steps, and then wash your own hands. An exposure is when anyone else's blood gets into your blood through an open cut or wound that has not completely healed yet. Broken or oozing skin, splash on the mucous membranes such as your eyes, nose, or mouth. The potential exposures are from administering first aid, cleaning assorted fluids in the restroom, but remember, only custodians should be the one cleaning contaminated surfaces, through punctures from needle sticks, or a human bite that breaks the skin. The first thing you should do if you're exposed is to wash the exposed area thoroughly with soap and water. We need to know the exposure occurred as soon as possible, so after you report it to your supervisor, please contact company nurse. Their number is 1-877-247-1445. We will make sure that you get immediate medical care. You also need to come to the Safety Services Office in Human Resources to fill out worker comp forms. Since we don't want to delay your medical treatment, please see us after your medical appointment to complete your worker comp forms. Here are a few things to remember. The written bloodborne pathogen exposure control plan is available at SCO's website. HBV, HCV, and HIV have all been documented in this county and can be transmitted by blood-to-blood contact. In regards to universal precautions, treat all blood and bodily fluids as if they're contaminated. Always wear your PPEs and never reuse gloves. Remember that exposure is direct body fluid contact. If you're exposed, please report it immediately and seek medical treatment. Remember that we're here for you and will work with you throughout this process. Please use universal precautions. Don't take the risk. Let's break the chain of infection. Please contact your supervisor or safety services with any questions you may have. District employees, please contact your Human Resources Department.